Antimicrobials, including antibiotics, antifungals, antivirals, and antiparasitics, are essential to the delivery of modern healthcare. Antimicrobial resistance, or AMR, occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illness, and death. AMR is among the most serious threats to public health in Canada and around the world. As resistance to antimicrobials increases, our ability to effectively treat even minor infections is threatened. Discovering new antimicrobials to fight the ever-evolving resistance to existing antimicrobials is critical. Yet recent assessments of the global antimicrobial pipeline show that the state of antimicrobial research and development is not sufficient. There are too few drugs in development to meet the current anticipated needs to treat resistant infections. The COVID-19 pandemic has demonstrated the impacts that untreatable or difficult to treat infections can have on both health and the global economy. Being prepared and having access to effective treatments is important. Antimicrobials, vaccines, and other therapies are essential to respond to future pandemics. A 2019 study by the Canadian Council of Academies estimated that the deaths of 5,400 Canadians were directly attributable to AMR in 2018, and that each resistant infection costs the healthcare system approximately $18,000. Left unabated, the cumulative impact in Canada through 2050 is projected to be massive, as many as 396,000 deaths, $120 billion in hospital costs, and $388 billion in lost gross domestic product. Creating viable markets and rewarding innovation are important mechanisms to motivate private investment and generate revenues that can sustain small and medium-sized enterprises while attracting reinvestment from large companies with the definite goal of strengthening the antimicrobial pipeline. The level of investment required to adequately finance a pull incentive is not insignificant. However, it is an investment worth weighing against the projected impact of AMR on the economy, healthcare system, and potential loss of life. Pull incentives are mechanisms that reward successful innovation of a health product by providing a known return on investment and creating a viable market. Evidence from several international studies and reports confirms the importance of pull incentives as part of a group of complementary strategies to strengthen the antimicrobial pipeline. Many countries, including the UK, Sweden, US, Germany, and France, have already made progress in developing or implementing a range of incentive models. Currently, several novel antibiotics have been approved for use in other jurisdictions but are unavailable to Canadian patients. In fact, of 18 novel antibiotics approved and commercially launched in 14 high-income countries between 2010 and 2019, only 2 had been introduced in Canada, the fewest number on the entire list, while other countries like the US introduced as many as 17. One of the key reasons novel antibiotics are not more accessible is because so few of them are coming to market. Pharmaceutical companies have either abandoned or neglected this market due to the high cost of developing these drugs and their limited return on investment. Meanwhile, for several business or administrative reasons, the few companies that have continued to develop novel antibiotics are not consistently bringing their products to the Canadian market. Canada's pull incentive model should prioritize new and innovative antimicrobials that address unmet medical needs and anticipate unmet clinical needs for antimicrobials in the next 5, 10, or 15 years. If incentive structures are not put in place, the future of antibiotic innovation is at serious risk. Antimicrobial resistance is a global problem that knows no borders. Now more than ever, Canada can show leadership by actively supporting international efforts to address the market failure of antimicrobials. Solving AMR is a vital part of Canada's national health security. It is essential that the Government of Canada seek to understand the challenges in the Canadian antimicrobial business model and to examine models and approaches that could help address these challenges.